Hi, Dr. Ravi here, and today we're going to talk about COVID-19, something that's in the news a lot, and specifically I want to talk about how to get back to normal. So if you're running a store, you're having some kind of establishment, or you're just interested in getting back out into society now, what are the things you need to do to be safe? Until there's a vaccine, the the emphasis is going to be on social distancing, wearing masks, washing the hands, and generally practicing a lot of precautions. There's nothing at the moment for treatment of the coronavirus, although a lot of different potential drugs are in the pipeline. At the moment, we still just have to practice being really safe. Probably the most important thing, and you hear this a lot in the news and all around, is keeping a distance. 6 feet is probably the preferred amount, although a little longer, a little further away, 2 meters isn't a bad idea. And that's to prevent the droplets which contain this virus from infecting somebody if a person sneezes or coughs. But the other thing is, because the virus can be in what's called an aerosol, in other words, it can actually be held up in the air, there are certain things that are of real importance. So masks. And there's absolutely nothing that points to a bad side or a negative associated with a mask. People should wear them when they're outdoors, when they're in public places, and most certainly should wear them when they're indoors and when you are around other people. Sometimes we can't practice full social distancing. We must wear masks. The mask must cover the nose, the mouth, and it must be well fit around the side of the face and snug. The mask protects others from your own aerosol and droplets, and it can protect you from other people in the environment. It is hard, and this is a very important point. It is hard to wear a mask continuously for hours. It is hard to wear a mask when you're talking. They tend to move. And people often have the mask below the nose, sometimes as low as the throat, or they're touching the face constantly trying to adjust the mask. This does nothing to help. And therefore, be very cautious, be very aware when you wear the masks. When you wear masks for long periods of time, if you're wearing it for several hours each day, those masks should either be washed if they're cloth or discarded for a new one if they're the disposable paper type of mask. The other thing that's very important, so social distancing, keeping the distance, especially in the workplace. So for people who are contemplating opening up their office and coming back to work, keeping people at a distance is very important. Wearing masks while at work, very important. Washing hands, simple soap and water is fine. 20 seconds of scrubbing the hands is fine. The hand sanitizers, which are a minimum 60% alcohol, can be used. They're not absolutely necessary. First of all, they're hard to get, and so just washing hands. My recommendation is for schools, for offices, for organizations where there are people indoors for periods of time, every hour, get up and go wash your hands for 20 seconds with soap and water. Doesn't matter what you're doing. You may be typing, get up, wash your hands. That's one of the most important things for preventing the spread of the coronavirus. Some office spaces are being designed now, and this is a whole other topic, with the flow of people in mind. So in other words, trying to avoid people going in opposite directions in narrow hallways is always the best thing. So you try to enter in one direction, have a flow in the office, and an exit in another location. If possible, that always helps. Then the importance of working from home, the importance of staying home if you have symptoms cannot be overemphasized. People who are running the offices, the managers, people who work there should be a common agreement that people who have symptoms, cough, fever, diarrhea, sore throat, maybe even headache, people who have symptoms that could be consistent with coronavirus should not come to work, period. That is not even debatable. And you should absolutely encourage this at the workplace. Putting a mask on and showing up to work is not going to help anybody. If work can be done from home, if there are, if there's 1 day a week, 2 days a week, when some people can stay at home, maybe do some of the work online or on the phone, that's highly advisable, and again, prevents the clustering of people in the workplace. Testing is another thing that's been touted as an important feature. Testing is very good when you want to trace the contacts. So if somebody is sick and you want to know, did they get in touch with 10 people, 20 people, and are those people infected, then doing that kind of contact-based testing is very good. But if you test people before they come back to work and they test negative, that tells you only one thing. That person is negative at that point in time. They could go out that evening to the market and get sick. And if you're relying on the negative test, what you have is an infected person at work the next day who could start to spread the virus to coworkers. So testing is valuable when it's taken in that context. And if people exhibit symptoms, if there are exposures, doing the test, and these are the tests for the virus, are useful, but taken in context. The other tests that people talk about are the antibody tests. So you draw some blood and you find out, does a person have an antibody to the coronavirus? That means, has that person been exposed? These are okay, but have a lot of problems. One, the sensitivity, the specificity, these are technical terms. How good is that test? How accurate is that test? Does it test only for the coronavirus, or will it pick up a bunch of other viruses that are hanging around in the mouth and the nose? That's a question still. Two, if the antibody is present, does it mean that that person is protected from infection? In other words, is the person immune? That is absolutely unknown at this point. And antibody testing should be used very, very cautiously. If it's going to be used to determine that someone has a passport of immunity, there will be many, many problems down the road. So I would recommend that the antibody tests be taken with a grain of salt at the moment. So to wrap it up, if you want to get back into society, open up business, schools, etc., we have to practice social distancing, use of masks, keeping the hands washed, every person, every hour, adjusting the flow so that people are not congregating in small areas and walking in opposite directions, trying to determine who can be at home safely, continue the work, absolutely avoiding the practice of coming to work if you're feeling sick, and using testing, that is, testing for the virus and antibody testing judiciously, carefully, not relying on those as a way to just allow people to do what they want. All of this is going to be essential until there's a durable vaccine, one that gives a response that protects. Until that time, or there's a ready treatment, this is reality. This is our new reality, and we just have to be cautious to try to control the spread of COVID-19.